So thank you for the introduction and the opportunity to continue our discussion about different types of studies and different types of designs. And COVID, for good or for bad, I know a lot of us have had, there have been a lot of good news in COVID, new developments. And one of those, I think, has been the interest that has emerged on the performance of studies at the community level and the international level. Do I need to pull this down? Sorry about that. It's like fingernails on a blackboard, isn't it? I know, made me shiver. So we'll talk a bit about community-based studies and international studies. Both of these types of studies have really emerged as important, and we've really seen the benefit and the critical nature of performing these types of studies. So we're still in the planning mode. We're still looking at how we're going to answer our research question. What is our population of interest? What is it that we are going to do then to bring benefit to society? So at this point, instead of looking at patients that we may be seeing in our hospital or in our clinic, in our healthcare setting, now we're looking at identifying population that from the community perspective, whether it is a local community perspective or whether it's an international community perspective. We're still going to follow all of the same processes in developing our question and then looking at the study design and determining then how we're going to craft our protocol and all of our processes. We're just going to be looking at it through a different type of lens. So we'll go through in our time together some approaches for community-based studies, some approaches for internationally based studies or studies that will be occurring outside our country area. And then how do we plan for success with those? Because as I go through those, you'll see very quickly that there are a number of nuances that you need to consider. And this really will stretch us in terms of what we have done previously. If many of our studies have been based through our health system or through our clinics or through our workplace. And now we're looking at this through a different perspective. The planning is going to be quite different. So we know traditionally when we plan a number of our studies that the beginning of this often takes place in a university setting or a health system setting where we are looking at the problem and we are kind of looking down at the problem. This is great because we have access then to patients and to families, to systems, to clinical operations that are all occurring in our work sphere. If we look at our priorities, the priorities may be quite different when we are looking at patients or our research participants from the health system perspective when compared to looking at what is happening in the community. So oftentimes our approaches in the traditional type of clinical research activities have been that we, from the medical perspective, look down at our population. I don't mean look down on them in a negative way. I'm just saying we're looking kind of from the top up. Here's what is happening to our patient population or in our patient population. But the communication and the activity is often one way, kind of from us to the patient and to the design of that study. So that top-down research. You know, they're growing publications. Interesting. Some of the first things that I read about community-based participatory research were really in the early 2000s, and the terminology was quite different for me. So this was a real learning experience, looking at the difference between community-placed research and community-based research on how you begin to approach then how you design the study, the type of questions that you will begin to ask, and the collaborators that you will need for success. So community-based types of research, whether they are local or international, can take a distinctly different approach. And that is much of the activity, the questions, and how you're going to conduct the research are emerging organically. So it's from within the community. So that is really guiding you in your success, in your ability to answer some very different types of questions. So I wanted to bring up and just kind of have some examples and comparing some of the work that we have done with some of the traditional approaches for research, and then how you might look at this differently if you are taking the peak then from the community upward into the health and healthcare sphere. So this was some results from a community-acquired pneumonia, a study looking at our community. This is Jefferson County, the Louisville Jefferson County area. And you'll look at the different colors, and the different colors indicate persons who are hospitalized with community-acquired pneumonia. So the darker the area, the greater the density, the incidence density of that is reflected. So those of you that know Louisville, you can see very clearly that we've got a difference in the colors between one area of the city and other areas of the city. The darker area showing the higher density is in the west end, or the western part of the community. So, we're looking at where does disease happen in our community, and this was a study looking at patients that were hospitalized across the entire community. So we were able to have a very good perspective. But I think this is very interesting that we're seeing then the disease in the community area. So this is what we were able to do when we were doing the research from the perspective of our traditional research approach. So if we begin to alter our paradigm, change our perspective, then we look at the performance of research that begins and emerges at the community level, has a very different perspective regarding the expert. Who is the expert? So when we are doing that traditional kind of top to the community type of research, the researchers at the university then are considered to be the expert. But what happens when we are looking from the community and then we are looking upward toward that level of expertise? Now, it's important to remember that doesn't mean, if you're doing community-based research, that you don't need that university type, that health system type experience. You certainly do. It just means that where that is placed and how that expertise is engaged and kind of who's leading may be different, may be very different. So research that takes place in outside the university setting or the health system setting is going to need to have that altered paradigm. This begins at the time you develop your research question, because you may have a very great idea on something that needs to be evaluated at the community level. But if you don't engage the community, then you are likely to find a number of barriers that will then make your research not feasible. So community-based participatory research supports the development of questions that really reflect what are the health issues that are present in that community. And not only the health issues that are present, but what type of factors that surround that health issue that may reflect our ability to produce the type of change. This also is important when we are thinking about any type of study. I think we'd mentioned earlier in some of the presentations, the importance of producing data that are generalizable, that are meaningful across populations. So if you are answering or desiring to ask a particular question, you've got to make sure that those that are engaged in the study, the participants, are reflective of the population of interest. And so if you are looking at doing research in the community, how will you approach participants? How will you increase the opportunity that you will be able to engage them and have them willing to participate in your research? And you need to be able to express the not only the risks and benefits, the costs of research and so forth very openly. And to do that, you need input from those that are at the community level, because you may not have the answers to those questions. So remember, it's not only dealing with the individual, but the individual is part of that community, and therefore your perspective needs to include the community. We've learned a lot and discussed a lot about the cultural aspects, cultural sensitivity, the equity issues, and that this is a distinct very distinct element in community-based research, that you understand your population, you are addressing and asking questions in ways that are relevant and accepted among the population of interest for your study. And the best way to do that is to involve the population in helping you develop those types of tools. If you are trying to uncover new knowledge, then you have to recognize the sensitivity that may be present. It was interesting. I worked with Dr. Weiss looking at vaccination issues and acceptance of vaccination. And if you are approaching trying to address some of the issues of vaccine hesitance, vaccine confidence in areas of the community, then you have to be willing to understand and listen to the perspectives that are coming from that community, because they may be quite surprising to you as a researcher, and it may really change your approach. So again, if I am deciding the question and I am asking it to a group, that's very different from asking the group, what are the issues involved in those particular areas of healthcare and healthcare practice? And the questions or the words that are used or the phrasing or even the emphasis of the question may be quite different. And so if you are going to be understanding those health issues that are present in that particular area involving the community is important. And then if you're going to recruit individuals to participate, and also if the type of study design that you have requires that you follow them over a period of time, enabling and being able to entice them to stay in the study for any type of follow-up, that retention aspect is critical. So if people feel like you are doing something to them, as opposed to doing something with them, you can expect your level of willingness to participate and recruitment to be quite different. And then again, helping individuals understand what the findings mean. At the end of the day, when you have your outcomes, engaging that population to help you not only with interpretation of those results, but how are you going to disseminate? Who is it going to be important to share those results? And then how are you going to craft your manuscript? So all of these aspects of research and developing and choosing study designs and choosing the areas where your research will occur, those initial questions are going to affect the entire pathway, the entire research journey. So thinking about them ahead of time is quite relevant. And all of those then will be important in determining the likelihood of your success. If you're coming up with findings and you think you have an intervention and you think you know the relevance, but you are not then taking into consideration what that means to your community, you may be unfortunately undermining your opportunity for success. So let me go back and give a couple of examples of how you might approach this. So I'll remind you again of the graphic, the map that we had that showed the incidence of community-acquired pneumonia. If we're going to be looking at this from a community perspective, there may be other things that are going to influence how we proceed or how we begin to craft our question. In this graph, we're looking at an area that the dotted line then is encompassing the area certainly of statistical risk. So that may be where we want to start with some of our activities, our areas of engagement, how we and who we speak with and who we include in the area inside that higher relative risk area versus those outside that relative risk area will be quite different, and certainly will give us different outcomes and different approaches and perspective to the disease. So this map takes that same area, but instead of looking at the incidence of community-acquired pneumonia, we're looking at poverty. And if you'll notice in the graph, the legend at the bottom, the darker the area, then the greater the density then of poverty in that particular area. And you'll notice immediately that in this graph, the darkest areas indicating poverty, the incidence, a greater incidence of poverty is very similar to the area of community-acquired pneumonia. So if we are going to then be looking at what community-acquired pneumonia, what this disease means to a community, then there are going to be factors that we need to take into consideration. So in this, that we may want to be thinking about, what is how might poverty impact not only our ability to perform a study, but how might poverty be one of the aspects of our research question if we are thinking about the effect of an intervention or a long-term research plan. So I want to take the whole, we've all been talking a lot about vaccination recently, haven't we? We've been thinking about, I think every publication I pick up, we're talking about how are we improving vaccination? How are we helping people understand, the differences between primary series and booster, and how do we improve acceptance of vaccination? So if we're going to be looking at this from a community-based approach, we're going to be looking at vaccine hesitance and how we can begin to have local conversations. And you can imagine the conversation that we would have in an area where we are seeking to improve immunization, where poverty is the most prevalent. The conversations that we have would be quite difficult, and and quite different than those that we would have in areas that are not experiencing many of those social constraints. So all of the conversations that we would have about community-based participatory research are going to be local conversations, local planning, local activities, local initiatives, local champions or leaders, and then local success metrics. So everything is different when we are looking at research from the community up. This is a picture of some interventions that have been done looking at how to improve immunization in the community. And it's interesting, isn't it, that we will look at, have we had immunization interventions in those areas where we are seeing the highest or the higher proportions or incidence of poverty. So although this graphic uses hues and shades of orange as opposed to brown, you can still see that we have areas that are experiencing poverty, living in poverty. We have some distinct areas where we have not had immunization interventions. So this may help us then think if we are going to improve immunization. Now, we don't know from this graph, have there been initiatives that have not been accepted by the local population? Have people tried to do that? We know that we always hear the phrase, build it and they will come. That is not going to be successful in many respects with community-based research, because you're taking something to the population instead of getting their impact. But the purpose is I want you to begin to think about the differences that are involved in, as we have listened to a number of our different research design approaches, on how this might differ significantly and how you might get very different types of results, but again, very different opportunities if we're looking at studies at the local level. Now, I talked about the studies at the local level within our community. Well, do these same rules apply if we're looking at studies internationally? I mean, certainly. That we have a number of countries outside the U.S. That are experiencing extreme poverty, that we will have the same challenges in trying to understand disease and the changes that may occur and the social constraints that are impacting our success with research internationally. So in addition to understanding, the local politics, you need to understand the local politics that may be present internationally. And if we're trying to do are working with groups that are doing international studies that are based at the local level, it's important that we realize that we know what we know, right? We know and we understand, or at least we think. Maybe that's too much. I'm not sure I understand U.S. politics, but I certainly don't understand international politics. And so to be successful, I will need to have someone that can help and interpret and then guide me as I'm trying to design a study where I've got to understand local bureaucracy and even the cultural complexities that are present in local international communities. There may be some pushback from people that view, that you're from a rich country, the U.S., you can't possibly understand. So I may need an intermediary that can help me then work. And that's true. I may not ever understand the aspects, but I can help then scientifically design a study as long as I have the right people that are working to guide and then can bring in the realities of doing research in those areas. By participating in research. And I think that really is the important thing. It's participation and it's collaboration instead of you are doing it to a community, that instead you are performing with. that you can bring some tremendous benefits that you will receive that you may not be able to get if you are staying within the constraints of your typical university or health system research. So a couple of examples that illustrate this. We've had the luxury of working with a number of countries around the world, all interested in looking at outcomes that are associated with pneumonia. So there is a large international studies that has a large number of countries that have entered data through a single data portal. So we've been able to look at what is happening in South America, what is happening in Europe, and what is happening in Africa. But all of these are primarily university or health systems that are looking at disease outcomes that they are identifying through the provision of care. So people come to the clinic or the hospital to receive care, and then pneumonia is identified at that time. So we're able to look at, what is present, but we are not able to say, well, what does this mean? What is it that we need to do then to prevent, or what is what's the trajectory of the recovery, or what changes now will occur in their life and their activity and their abilities, and how is that going to impact then their return to a sense of new normal? What will that mean to them at the community level? So our look at international research would be very different, and not only through this community-acquired pneumonia organization. So international research, again, just like our local community-based research, what does the population want? What do they value? And then who are the champions that can help us approach research? What are the cultural barriers? What are the cultural norms? And how will we make those changes? And the change needs to be sustainable and meaningful. To plan for success, we've got to make sure that we are picking the right approach, the right design, including the right people, that we can't make the decision for the community. They need to be active participants. So know your population before you start the study is a priority. Recognize the heart of the study actually comes from the community, and then support and facilitate planning. So whatever happens emerges from the community, and that happens through the local championship, that local leadership. Provide assistance. That's the important part of people that have experience with clinical research. We are providing consultative approaches. We are providing the expertise. We are not taking the place, but it's important that we are still active participants. And then approach the study with an appreciation for what is happening at the community level and the importance of their local leadership. So we've talked about approaches for community-based and international studies, and then planning for success. So I hope this sets you up then to add this perspective to your consideration about clinical research. So with that, let me turn it back on then to my next compatriot.